Good afternoon, everyone. I am David Oliva, and today I'll be going over figure skating and common injuries and treatments found within this sport. For the overview today, I'll be going over the figure skating athletes, basic statistics on what type of athletes usually go into the professional Olympic sport, because that's going to be the more prone audience to injury, especially overuse injury. Additionally, factors of figure skating injuries, such as the environment, protective equipment, or lack thereof, and also the just the ability to skate on ice alone is dangerous on itself. Also going to be going over the common injuries that are found in figure skating, and I'll be wrapping up with a summary at the very end. So figure skating. Figure skating is the oldest winter Olympic sport that's currently in the Olympics. It was invented by the Dutch for skating down canals for village communication. Edward Bushnell invented the actual ice skate itself in America, and later on Jackson Haynes got a hold of that ice skate and added elements of ballet since he was a ballet dancer, and thus gave ice skating its current grace as it's known as today in the Olympic sport, and also remains one of the most popular Olympic sports in history. So figure skating factors. Athletes tend to start at very early ages, especially Olympians, anywhere from like 2 to 5 from some of the earliest that I saw. The average is around 10 to 12 years old. Practice with figure skating and ballet is very common, as both go hand in hand in this type of sport. Exercise, jumping, harsh landings is common in the sport as well. As we see from the Olympics, the Winter Olympics, that the landings are just sometimes they look so graceful, but in practice you don't see a lot of overuse injuries and falls and accidents when it comes to figure skating. On top of that, the environment is usually temperature controlled, especially inside of an ice rink. Might not be the case and outside, but I haven't read of any hypothermic type situations as of yet. Ice rinks are going to be the most common practice area. So also, when my research I was doing is that ice skates are normally the only protective equipment worn by the athlete. And with that being said, they're not wearing knee pads, helmets, or elbow pads or nothing like that. It's just reinforced leather to keep the ankle stabilized, and that's about it when it comes to ice skates and protective equipment. Also, there's more female athletes than male. So the anatomy of the first injury I'm going to be going over is going to be the inversion ankle sprain. And the biggest ligament that's at risk for this injury is going to be the anterior talofibular ligament, which is seen here. And it's going to be one of the 3 major lateral ligaments. And what happens is that when this injury, or hyperinversion, like to call it, is sustained, it can also give damage to the calcaneofibular ligament and posterior talofibular ligament. And these types of ligaments prevent the foot from sliding forward. And the anterior talofibular ligament attaches from the talus to the lateral malleolus, which is going to be that outward ankle, or the ankle that we feel when we palpate with our hands. So the mechanisms of injury when it comes to the inversion ankle sprain usually occurs from a jump landing, which is very common in ice skating. Athlete loses pilot control of the ankle, and the ankle inversion injury occurs, in which hyperinversion damages ligaments. As you can see right here, take a look at the athlete in red. Essentially, boom, right there. As you can see, it's going to zoom in here in a second. That right there is going to be that inversion ankle injury. And it's common amongst figure skaters because if the landing is just not perfect, the inversion ankle injury, which is a very common injury found in ankle sprains, is going to be the main culprit. And it's mostly caused from landing incorrectly. As you can see right here, here's another anatomical view of the actual sprain itself. You can see right here the anterior talofibular ligament is actually torn altogether. So it's just going to be one of those sprains where you just have to look out for it. And you may think, how am I going to look out for this sprain? Well, you can do the inversion ankle sprain, the anterior drawer test. And essentially, you're going to position the foot 9 degrees to the lower leg, grasp the lower tibia and the calcaneus in the palm of the other hand. Tibia is pushed backward as calcaneus is pulled forward. Foot sliding forward is a positive test. You might hear some crunching at the very end point of this test, and just be on the lookout for that. For this type of rehabilitation, I recommend for inversion ankle sprain is going to be proprioceptive neuromuscular facilitation, in which PNF for short PNF stretching techniques are commonly used in the athletic and clinical environments to enhance both active and passive range of motion with a view to optimizing motor performance and rehabilitation. So it says Sharman, Creswell, and Rake 2015. And overall, what you're going to want to do is just do continuous repetitions of 30 seconds. You're going to, here in the video, you're going to practice inversion, eversion, flexion, and then extension. So 2 to 4 sets of each motion, increasing with each week, twice daily, 3 times a week. Continue until pain-free with a full range of motion. Once you get to that point, you can go ahead and stop the PNF exercises. Next, another common injury that I found in figure skating is going to be the ACL, or anterior cruciate ligament. And the anatomy of this is, you can see right here from a deep view, because usually the patellar ligament is blocking the view from this, looking at it superficially. But on a deep view, you're going to see it's one of the 4 major knee ligaments, and it resists anterior translation of the knee, and also resists medial rotation of the tibia, and attaches from the femur to the tibia. You see right here is going to be the attachment side from the femur, and then lastly the fibia. And this one right here, the mechanisms of injury is not exactly known. The exact cause is unknown. Typically caused from deceleration from a jump or forward running motion. And as you saw, there's always a lot of forward motion or a lot of forward momentum when it comes to ice skating, especially when you're going at fast speeds. And also there's incredible amounts of jumping with this sport as well, especially the Olympians and professional athletes. What happens is that as the valgus forces are at play, and a contraction of the quadriceps is common. But what happens when you get this perfect storm, a lot of anterior sheath and internal rotation of the lateral tibia happens with this injury. And you can see from the video right here, you may not always be able to see this injury or exactly what causes it. You're just going to know the athlete's going to find something wrong, because look, it looked like the athlete just landed perfectly normal, but that wasn't quite the case. They had an ACL sprain. So you may think, okay, so what am I looking at anatomically? You can see right here, here's an ACL with a level 3 or grade 3 sprain or complete tear. And the type of test you can do is the drawer test at 90 degrees. You're going to have the athlete on the table, knee will be flexed, trainer will face the anterior aspect of the athlete, and both hands encircling the upper portion of the leg immediately below the knee joint. And position fingers near the popliteal space, and thumbs on the medial and lateral joint lines. Also, you want to put your index fingers essentially behind the knee, so you can place that on the hamstring tendon, and the tibia slides forward under the femur. This is a positive test. You can see right here from this video, the first test is going to be positive, and the second will be negative. So we're looking, and then the trainer is thus going to do the. There you can see some of that forward motion. That's not good. That's going to be that motion you don't want to see. And this one right here, the negative test, or the no ACL sprain, it's not going to be nearly as much anterior motion, if you will. So for this one right here, for ACL sprain, I recommend weight training. Now, I recommend doing a close kinetic chain, flexion, extension, not open kinetic chain, because you have a lot of synergistic muscles. And it's not exactly what you want to be doing. You just want to slowly introduce low amounts of weight. And with weight training, I also recommend waiting 1 to 2 weeks before starting this. I had to choose one, but this is going to be one of the most common ones I recommend for rehabilitating the ACL. And this is going to be conducted 1 to 2 weeks of the body after the body weight and minimal weight exercises are done. I can do around 10 repetitions, 2 to 4 sets each motion of the knee extension and flexion, increasing with each week. And see right here, we're going to do the knee extension exercise. And conduct this 2 times a week, and increase weight if pain-free, or continue until you have you're able to return to pre-injury status. And here we're going to do the knee flexion. Okay. So next, for the last one, we have the patellofemoral pain syndrome. The knee anatomy for this one is going to be the patellar ligament. As you can see right here from the picture, it's going to be right below the patella, attaching to the tibia. And patella aids contraction of the quadriceps, so it's going to be continuous with the quadriceps tendon as well. And overall, this is going to mostly aid in knee extension. So for the mechanisms of injury, what happens is as there's a lot of chronic jumping and a lot of running suspected in figure skating, in which the softening of the articular cartilage can happen or occur, tearing and spraining the patellar ligament. And then also the body physique and genetics play a role, such as when your quadriceps are hypertrophied and the rest of your muscles are atrophied. That can also create a body physique imbalance, and that can create a lot of tight anatomical structures. These are some of the most common reasons why PFPS happens. But overall, when it comes to a lot of chronic jumping, this is going to be one of those chronic overuse injuries that are seen in figure skating. So what type of test you could do to figure out if indeed your athlete does have PFPS or starting to get that is do the patellar grind test. And the athlete's going to be on the table, knee will be fully extended, and trainer will place hand palm down on the superior portion of the patella, and place thumb and index finger, which will cup the patella on the top, and then you're going to apply pressure. And once you apply pressure, you're going to ask the athlete to contract their quadriceps. You can see right here. There's the contraction of the quadriceps. Now, as that happens, if any pain is felt by the athlete, that's going to be a positive test for this. And so for the rehabilitation for this one, I recommend doing calisthenic squats. Why? Because you want to keep, it's already possibly a level 1 or level 2 grade sprain on the patellar ligament. So you won't try to aggravate that injury anymore and turn it into a chronic injury or a tendonitis, if you will. But no weights are required for this, and it's conducted when the athlete is able, probably most likely beginning immediately. You're going to do from 10 to 30 repetitions, whatever the athlete feels comfortable with. 2 to 6 sets of the motion, as you can see right here, and with the weight increasing the amount of repetitions increasing each week. You can also increase the sets as well. And you can conduct this 3 to 5 times a week. You can do it every day, essentially. There's nothing wrong with that. But you also want to give some time for your muscles to heal, and also the damaged ligaments, if you will, especially the patellar ligaments, to heal. So yeah, I recommend anywhere from 3 from the beginning and 5 later on. And increase repetitions and sets as you're able to do so. And continuous exercise until PFPS symptoms are alleviated is what we're trying to go for. And overall, this concludes my briefing on the common injuries of ice skating. We talked about the inversion ankle sprain not only being one of the most common ankle injuries, but also very common in ice skating. ACL, one of the most devastating knee sprains that an athlete can actually incur. So this will be one of those ones that's very important as the athlete trainer to keep an eye out for. And lastly, you have PFPS. And fortunately for this one can be reversed, but it takes around 6 months to a year for symptoms to fully go away. But other than that, this concludes my briefing. I just want to say thank you and go Lancers.